Talking about health supply chain cannot be separated from talking about supply chain in general.
You can't have a supply chain system that you don't fund.
Every organization is talking automation now after COVID.
Manufacturing capacities that are not well equally distributed around the globe.
I'm a really big believer in data.
COVID taught us a very big lesson in every aspect of our supply chain management. And looking at COVID, we have a tendency to lean back and say that the issues that we saw during COVID, brought all these challenges in the humanitarian supply chain. Within the health sector, these challenges have been there pre-COVID.
I think it's the availability locally of those quality items. Currently, most NGOs or agencies in the sector look to the international supply chain. I think there's still not that confidence in the local suppliers to be able to deliver at the quality that's needed.
We could see that supply chains, which is lacking agility, which is lacking adaptability, could not continue. We could see the need for supply chain systems and operations that basically adapt to these sudden changes on requirement.
When COVID caught up with us, we realized that in many countries that we had strategic plans for supply chain, but we didn't have strategic plans for supply chain emergency.
Accessibility is one point, but also availability of resources is another point. The timely availability is something, so the time is a critical factor in what we are talking about. And when it reaches the health systems and health profile in general, it is very crucial because it is life and death.
I think first we need to be thinking around our risk assessments and management, because we saw the disruption that happened in our supply chain, the fragility, the complexity of our supply chains.
Investing in human resource and ensuring that this human resource is able to support responses to emergencies in the health sector.
The other main challenge was the lack of data and visibility. We could not know, for example, where are the stocks, who has them, how to reach them, where are the shipments.
It's not only about data. You need strong people capacity, you need processes that lend themselves. But I think it starts with data. When people are working blind, when they have no information about what's going on, it's hard for them to make decisions. And resilience is about taking action in the face of a shock, in the face of changes.
When you say resilience, you need to have an efficient supply chain, you need to optimize that, then you need to build in resilience. We have a long journey, and it all starts with country ownership and financing. Those are the critical things.